what we're hoping to do, seminars, bring some great speakers together and help us take a look at what we can do in terms of analysing, developing, testing and working together to improve our services and ensure that the reach that we have within the capacity of services meets our children and young people. And some of the key principles is around putting children and young people at the centre, is around the leadership and culture, around focusing on outcomes, around analysing, developing, testing, learning together. It's about winning our hearts and minds of our staff, and it's about bringing staff and service user together. So hopefully we've got a packed agenda to look at with some great speakers to start this conversation off. So we've got Nisha from Public Health England, we've got Grayson from Porchlight, and we've got Will and Lucia from Boys in Mind, Girls Mind too. So hopefully we've got some great speakers for you to listen to, and then we'll go into questions and discussions for the last half hour. Nisha, I'll pass over to you. You've got till 25 past, and I'll pop up 5 minutes before, if that's okay.
Absolutely fine, yes. Right. So first of all, thank you very much for inviting me to speak about children and young people's mental health and also wider determinants that really impact, and more recently, the COVID-19 impact on health inequalities and mental health. I am Nisha Sharma. I'm public health. At the start, acknowledge that, these about 50-60 odd slides aren't my doing. My local intelligence colleagues, Susan and Sarah, have been very helpful. Also bear in mind that, 20 minutes is not going to be enough for me to take you through all the slides, but they will be there as a ready reckoner for you when you're thinking about local planning and health inequalities and focus on most vulnerable young people in our communities and populations. As I go through the slides, you will see all data sources are mentioned throughout. And the last 4 slides are actually resource slides. So everything that I'm going to talk about, the links, where you can find information, etc., is on those last 4 slides. Carrie, next one, please. Okay, I think Carrie had just started to touch on this. The case and rationale for why we need to focus on health inequalities is very well established. And this very first slide really just gives you idea about some of the national drivers. I think recent events of COVID-19 pandemic has exacerbated the current health inequalities and in some cases created some more health inequalities. We know, from the Marmot report, which has recently, about a couple of years ago, published its second report, that national drivers and wider determinants such as poverty, housing, social policy, deprivation, long-term conditions, and more recently the huge impact of COVID-19, is really difficult from a mental health perspective. People living in least deprived areas live between 18 to 20 years longer than people who live in most deprived areas. And socioeconomic mobility has lasting impact both on physical and mental health outcomes for vulnerable population, and particularly for children and young people. Next one, please, Carrie. This slide, because this is such a recent publication, this slide really highlights some of the high level and very stark realities on health inequalities. This is the Royal College of Pediatrics and Child Health, and it is a real-time surveillance of a range of indicators, routine indicators across the UK, so all 4 nations, on children and young people's health outcomes by comparing available data. And these are very, very stark highlights. Child poverty has increased for those between 0 to 18 years in working families. So these are working families. And after housing cost, that has a big, big impact on young people in these families. Mental health prevalence in children aged 5 to 15 and suicide rate per 100,000 aged 15 to 24 is also increasing. We know now from a lot of research around adverse childhood experiences that quite a lot of mental health conditions are well set 14, and therefore early action and a system-wide action is really important. And then there are, other key highlights. I have given a link of this particular report. I think it's worth reading at least the executive summary for anybody who's looking to pull together work locally, particularly with most vulnerable populations, because I can't go through all of it together. But executive summary is a good indicator as to where the national policy and trends are heading. Next one, Kerry. Sorry, I'm just going to admit, okay, there was something on the screen. And this slide actually just carries on with some of those stark warnings. I'm just going to read out the last one. The most deprived 10% of children are nearly twice as likely to die as the most advantaged 10% of children. And then there are, other things like for low income children, level of good development are higher in most deprived areas than in less deprived areas. So it is worth having a look at this data. It is most recent, it is fresh. There are a range of indicators which are very easy to manipulate and look for your own particular local areas. And I'll just give you a second to just read through this slide. You will get copies of these to digest in your own time, because I'm not going to sort of read through all the little bullet points. Carrie, next one, please. Okay, so moving on to now what the COVID-19, since February, March time this year has done to health inequalities in general, because health inequalities in general are really impacting on children and young people's mental health, and what is specifically going on in terms of real-time surveillance for children and young people themselves. So, the impact of COVID-19, especially on the most vulnerable groups and communities, cannot be overstated, as evidenced by the two recent Public Health England reports. One of this is just mentioned on this slide. And it has replicated existing health inequalities and in some cases has increased these disparities in health outcomes. Again, there is an executive summary in this report that really highlights the most affected population, including Black and minority ethnic groups, children and young people, young adults, university populations, and social and isolation generally in families. Next one, please, Kerry. So this slide now shows the deprivation and how COVID-19 impacting the most deprived communities than the least deprived communities. I mean, you can see the rate is almost 1.9 times higher in least deprived for males and 1.7 times the rate for females. So the colors are highlighting male and female cases. So this is case diagnosis. And the next slide is actually mortality. Kerry, next one, please. Yeah, so these are the mortality rates. So the risk of dying among those diagnosed with COVID-19 is higher in those living in the most deprived areas. So it is thinking about the communities that are worst affected and what can be done as a system approach with those populations. Children of those populations and in those areas obviously have worst outcomes, although nobody is completely without any impact on mental health generally in any case. Next one, Gary. Okay, this slide highlights the ethnicity. So age standardized COVID-19 diagnosis in other and Black ethnic groups is lot more, as you can see here. This one shows the last two bars. and the Black and Black British group, both the cases as well as the mortality rate is much, much higher in Black and minority ethnic community. So in the case of children and young people and their mental health, it is thinking about bereavement, in those families, what is going on to the children and young people's mental health themselves, and what if they already have established mental health conditions, are they accessing services, and are services actually appropriate to their needs? Next one, Carrie. And this graph now shows the mortality rates in a infographic way. So the risk of dying or mortality rate among those diagnosed with COVID-19 is higher in those in Black, Asian, and minority ethnic groups than in white ethnic groups. And these lines, which are horizontal lines, are now showing the rate in those particular communities. And you can see Bangladeshi as well as Pakistani community have much more mortality rate than any other groups. Next one, Carrie, please. So this is now these couple of slides. I think I just want to orientate our minds as to considering what we have just seen in these slides, the impact and what is going on for children and young people's mental health. Consider the very recent news and case of free school meals. It is a very topical topic, but these are real issues impacting some of the most vulnerable families and children in our communities. So any plans you're looking at making, considering the focus on most vulnerable groups, is thinking about all those issues. Deprivation plays a big part, so is urbanization. So local authorities with the highest diagnosis and death rates are urban and densely populated areas. And what is happening around facilities, the play facilities, schools being closed, what would be normal for those children to access is not the case now. So how to tailor and modify services in a way that looks after the needs of those children and young people, and how that's impacting on their mental health. Ethnicity, of course, we've talked about in detail. Next one, Carrie. And occupation, any service planning you're doing, this is quite a stark figure, a total of over close to 11,000 COVID-19 cases. And this data is now a couple of months old. We are seeing second wave as we are talking through, numbers and cases in health and care settings are going up. So these are frontline workers. These are nurses, doctors, midwives, and what is happening to the children and their mental health of those key workers. So it's thinking about that. Working age males are diagnosed a lot more with COVID-19 cases, particularly in certain occupations. So it's thinking about that, and certainly age. It's older people. So what is going on around bereavement and loss of grandparents? Next one, Carrie. And I think this is the subsequent report. So I mentioned earlier that there are two reports that Public Health England has published recently, both focusing on health inequalities and the impact of COVID-19. And this one really highlights, actually goes deeper into data for Black and minority ethnic communities, and how risk, and some of the system level challenges which were there already, like racism, discrimination, stigma, etc., have really exacerbated what is already there in terms of health inequalities, and how that is affecting the mental well-being of those families as well as children in those families. Next one, Carrie. So I think when you are thinking about BAME groups, it's thinking what is different about those particular communities and how services need to be tailored. There's a lot more intergenerational living, particularly in certain communities. So it's considering that and what is linked in terms of service access for children from those families. Ethnic minority groups also face particular risk of social isolation and loneliness. It's tailoring the services to deal with that and existing mental ill health. I think one thing that, Kerry, hopefully, as we go through this presentation and other speakers will speak, it is about people with severe mental illness, children and young people who already have mental health conditions and are accessing services. Those services are being delivered very differently and are actually digital way of delivering services, meeting the need of those people that need that service and need a more appropriate service. Next one, please, Carrie. And there are a few more points about Black and minority ethnic communities on this. Again, I won't read out the whole these 2 points, but I have given the sources on this slide. Okay, 5 minutes left, got the point. There are sources on these slides for you to look into detail about these particular groups in more depth when you get a chance. Next one, please, Carrie. So now this is where I come that I cannot present due to the benefit of time, everything that I have prepared. But from this slide onwards up to slide 43, when you get these slides in your pack, we have now tried to cut the data at Southeast level, among very many indicators. What is the total population, where the low income families are, for example. Can you just keep flicking and we'll just free school meals, children with special educational needs, children who are admitted to hospital with self-harm. These are special health inequality distribution, age distribution of SEND children. So there is a little bit more about NEET children who are not in education and employment, pupil absence, primary school exclusions, because all these indicators link with children and young people's mental health. So to make things easier for you for local planning, this data is cut at local authority level. And from this slide onwards, and the next 10 slides are specific to the data provided via the wider impacts of COVID-19 on health. So lovingly called the WITCH tool. Next one, Carrie. And why I have added these slides is because these particularly look at real-time mental health surveillance for population. So trends around anxiety, depression, loneliness, and there is a spotlight on children and young people, both for age 13 to 18-year-olds who are affected, but particularly young adults aged between 18 to 29-year-old who are more affected by COVID-19, also impact on parents and carers. And all this is really important because this surveillance is as we speak. So this is fresh, real-time surveillance on people's mental health. Carrie, next one. I'm going to now jump to slide 55 straight to the summary. And that is just bearing in time in mind so that I finish at 2:25. So in a nutshell, many improvements in health and well-being of children and young people were made. However, inequalities are stark and therefore any local action has to be system-wide. No one organization can deal with health inequalities, particularly around mental health, in one go. So today's workshop is very timely, very important. There is a lot more we can give you around data. I think first thing for me to say would be that local authorities as well as CCG and STP leads will have data and intelligence people in their teams who are linked with Public Health England's data and intelligence team. So once you've digested all the information we give you today, and if you have then specific tailor-made request for data and intelligence for your patch, we can certainly look at those reports. But to close this, there is a significant body of evidence and research describing the scale, nature, and causes of inequalities, particularly mental health inequalities. More recent reports, the WITCH tools, it's now making sense of all this. And as you go through implementing the mental health support teams in schools, it's bearing in mind that focus for the most vulnerable and the appropriate and tailored services that meet their need in that given point in time. Next one, Carrie, just to show that how the resources slides would look like. So the lot of the data that I have presented today is from Public Health in England's Fingertips tool. It is a very interactive data tool that any of you can have access. Just Google PHE Fingertips. There is a children and young people's mental health and well-being profile page. It is so interactive. You have to just press the start button and start playing with data for your local authority, for your CCG, and you can cut that data and compare and contrast that data in as many ways as you like. Next one, Carrie. And this is the which tool detail. So this is more real time impact of COVID-19 on the health and well-being, including mental health on children and young people, as well as populations. Next one, please. Some more on which tool. Next one. And some more information. So idea is to give you these slides would mean we are not just talking very quickly for 15-20 minutes, but giving you some tools and tips in these resource slides that you can go back to anytime you have to do local planning. And thank you very much. I'll stop there.
Thank you, Nisha. Due to time and Kel and Grayson need to go, can we hold questions for Nisha until the end and move on to the next section, please? So what's been really great is hopefully we've given you an idea of the sort of intelligence that helps us in terms of thinking and planning, and given you the links to resources where you can find it. And as I say, Nisha and I will send this information out for you. The next step in terms of helping us in terms of service improvement is around listening to your service users and hearing what they're saying. So we've got the opportunity to look at three groups of young people this afternoon. Grace and Kel, do you want me to give you back the screen? Shall I let you have control now? Do you want to come on?
I think for ease, if you keep hold of the screen and we'll talk over it, and I'll just ask you to change slides, Kerry, if that's okay for you.
Yeah, that's great. Do you want to put your cameras on? Because it'd be lovely to see you both, and I'll drop out and then come up 5 minutes before the end.
Okay. So hopefully you can all see me and my colleague Grayson. So my name's Kel Williams. I'm the project manager of the BU service, and my pronouns are she and her. And I'll let my colleague Grayson introduce themselves.
Hi, I'm Grayson. My pronouns are they and them, and I work in Dartford, Gravesham and Swanley on the BU project under Porchlight, which we're going to talk to you about today.
So the BU project is a support service run by Porchlight, which seeks to connect young people in Kent who are lesbian, gay, bisexual, trans, non-binary, or questioning their sexual orientation and or gender identity. Since the project was founded in 2018, the importance and necessity of BU has continuously increased relative to the ever increasing number of LGBT plus individuals within the UK. The Office of National Statistics has said that identifying as lesbian, gay or bisexual increased from 1.6% in 2014 to 2.2% in 2018. It was also found that younger people aged 16 to 24 years were most likely to identify as LGB in 2018. Therefore, the existence of a project like the BU service is now more important than ever. So why is it necessary? Well, LGBT plus youth experience a disproportionate burden of negative health and mental health outcomes compared to their heterosexual counterparts. Common negative mental health outcomes include anxiety, depression, suicidality. While suicide rates among under 25s in general have increased in recent years, LGBT plus youth are subject to stresses exclusive to those who do not conform to heteronormativity, making them far more likely to show signs of poor mental health. Stressors can include interpersonal challenges such as homophobia and harassment within their school, home or workplace, or interpersonal challenges like something as simple as just having to conceal your identity. And that is something as a project that we found over lockdown, where young people might have been accessing school or youth clubs before and able to wear bands or adapt behaviour that they feel expresses their gender and sexuality. If they're not out at home, they've been unable to always do that. And I'd just like to touch on a point that Nisha made in her presentation before on ACEs. There has been some research on ACEs and the LGBT plus community, and for LGBT plus people, there are specific experiences of rejection and isolation in childhood, which can cause stress. Can you go to the next slide, please? So fairly soon after lockdown began, within the first week, we managed to get all of our support groups running online, offering face-to-face support via Zoom, video links as well. So we do provide support in all of these areas. Whereas before COVID hit, we were running in every district every week. We're now running maybe 3 for under 18s a week, but they're open to Kent-wide young people. So young people, instead of just going to one support group, they can come to multiple support groups throughout the week if they wish. We also deliver some training and have traditionally gone into schools to give assemblies and given information on how people can refer into the service. We're currently at the moment working on a bit of a film that will be played into schools because we've been finding it difficult to get in because of COVID restrictions and things. So that's something as a team we're working on. Next slide, please. So accessing services for young LGBT plus people, and when we were putting this presentation together, we were specifically thinking of young trans people. There does seem to be an inconsistency in GP knowledge, young people having difficulty getting referrals done to GIDS. We've got, and that's the Gender Identity and Development Service. We do have experience of even parents coming to our parent group and saying the doctor refused to do a referral to the Gender Identity Clinic, and the GP refusing to use the chosen pronouns by the child and the parents, and refusing to use the name that they had adopted. Identifying as trans does not necessarily mean that you'll need to access CAMS, and I think that's a message that not all GPs are aware of. They think that all young people need to go through CAMS service, and then obviously they've got to wait for that service before then an additional wait for GIDS to begin. Some young people still need support to manage anxiety, but aren't necessarily helped whilst they wait for the Gender Identity and Development Service, as it is quite commonly assumed that the Gender Identity Development Service will be the answer. Experiencing things like dysphoria can trigger other mental health issues, anxiety, eating disorders, isolation, social anxiety. And I mean, right across the LGBT plus community, you see young people not wanting to go to school. Homophobia still exists. You know, and we talk very much when we go into assemblies about it being a continuum. On one end, we have flippant throwaway comments like "that's so gay," and on the other end of the spectrum, we have people that are seriously injured out of hatred. You know, they're worlds apart, but they're on the same continuum. And we try and talk about how language can inform attitudes and beliefs that then can go on to inspire somebody to do these hateful things. And also how it's very damaging to not hear the word that you identify in used in a positive context. If you only ever hear your label used negatively, you are going to pick up feelings of shame and, you know, generally not feel good about yourself. The other thing about accessing services is that young LGBT plus people need to see visual indicators that they are included and that this is much for them. And a way that people can do that is making sure things like trans flags, rainbow flags, posters that specifically address the LGBT plus community are included in waiting rooms, quiet spaces, notice boards, that kind of thing, rainbow lanyards. Grayson and I delivered some training in a school once, and it was done in 2 parts. And we'd suggested this use of the rainbow lanyards. And when the teachers came in for the second time and said, "Oh, we did what you said," you know, the headmaster went out and bought all these rainbow lanyards. They said there was a marked improvement in conversations about young people talking about their experiences and also about their families and the diversity of their wider family networks and things, because they then felt that the teachers were informed enough to be able to support them and to have a conversation with them about being LGBT plus. Another, going back to accessing service, another issue that some people had encountered was being too old for the child service and then being transferred to the adult team and having to wait again. So when a child reaches 17 and 7 months, they should be transferred to the adult team and they're time honoured. I do believe that is happening more now, but there have been cases where people have gone back to the beginning, having waited months to see a professional.
Sorry, Kel, can I just add something as well? That when we're accessing services and those services don't seem appropriate for us because they're not targeted to us, one way that you can help deal with this issue is by simply collecting monitoring in a way that is inclusive. So if you have paperwork or forms that your service users or your clients or however you want to call it out, and make sure that those forms include a variety of identities and that you're not just targeting saying, "Oh, so you identify as gay, so I need to ask you all these questions." You need to ask everyone the same questions so that it's across the board equal and anyone can feel that their identity is being completely honoured and given the opportunity to be talked about, and it's not a shameful thing or a taboo thing to have to ask.
Thanks for that, Grace. And actually, in a lot of reports that are being published at the moment, you know, that is really stressed that LGBT plus people need to be counted to count. You know, and people get stuck on the privacy issue. And actually, privacy is a right that people can access, but you've still got to ask them the question. There, you know, with any of the protected characteristics, there should always be a prefer not to say option. And other things that came up about accessing services was things like people not feeling sure what toilet they were allowed to use. So there not being a gender neutral toilet, or there not being cubicles in the male toilet, or there not being facilities in the male toilets that would be accessible for maybe a trans man. Next slide, please. So I said in the beginning, my pronouns were she and her, and Grayson introduced himself as they and them. At the beginning of all our meetings and all our groups, we tend to go round and say what our pronouns are out of good practice. Otherwise, anybody that does identify as non-binary may get misgendered, and also it comes down to your perception on whether or not you feel somebody is female or male, and there is always room to get that wrong. So as a measure of good practice, we start every meeting with our pronouns. It's on all of our signatures as well. You know, and young people are using different pronouns to better match their identity. And you might have, you know, youth culture is really pushing these different identities, different ways to describe themselves. They don't want to be stuck in their same binary boxes and limiting roles that they might have been given at birth. And so, you know, they are finding new ways to describe and identify themselves. And you know, in another 5 years, these young people are going to be coming into the workforces, even your workforces. So it's not just about the patients that you're supporting, but actually the diversity of what your staff team might look like in the next 5 or 6 years. Next slide, please. So I'm just going to hand over to Grayson. We were due to have a service user come in today to talk about their experience. However, unfortunately, they couldn't download their Teams app. So Grayson's going to read out some of their notes.
Hi, everybody. I'm just going to access my Word document and then I'll be right with you. I'm just going to read out some of the things that, that our client has said. So, the NHS clearly lacks funding and care towards the side of mental health. I've known people to wait, and some who are still waiting around 2 years to simply be seen to address their mental health. This can result in mental health worsening and can increase the likelihood of self-harm and suicide. My first experience with mental health services was with CAMS around 2010. I only saw them once as the appointment was that poor. I was 10 years old and processing my parents' divorce. They simply asked who I wanted to live with and I cried the entire appointment. There was no acknowledgement this was a strange and hard thing for me to process. At the beginning of secondary school, I saw a therapist within school. I don't know if this comes under the NHS. They were very lovely, but nothing really progressed. It became more of a venting session. I saw a few therapists through Medway Hospital in the same department as my diabetes specialists. They were great, but it got to the point where I had a new therapist every time I went and ending up doing the introduction session over and over again. During all this, something wasn't right and I couldn't understand what it was. Over time, I'd learned that I was transgender and was very scared to talk to anyone about it as certain family members were not accepting of it. And I didn't want to even think about the possibility of being kicked out, so I pushed it down for a long time and didn't really come out until college. At college, I spoke to someone there about my mental health again. I'm unsure if that was through the NHS, but I felt that there was a big disregard towards how I was feeling. It seemed more like a chore to them to be helping me. I understand it can be a draining job and I cannot be the easiest with words, but it did feel rather backhanded, and a few other people have experienced the same. I found out about the BU project and local LGBTQ plus group when I was a few months on testosterone. I was aware of what was going to happen, but being able to talk to Grayson about testosterone and top surgery was a massive weight off my shoulders. It was something that I hadn't been able to talk to anyone about because I didn't know many people that had been through this process. I did later find a wonderful network of people online. However, Grayson was brilliant with helping me to coherently vent out how I felt and was able to empathise and give me the best advice. On days when I was quieter, maybe drawing, they would always find a way to check in with me, which was very grounding, but they also knew that I was enjoying the atmosphere without necessarily contributing to it. If it wasn't for the BU project, I wouldn't be as confident and as outspoken as I am now, even though everyone there really helped me blossom into the adult I've become. I'm incredibly thankful for that. The NHS needs more funding for mental health services. The waiting lists are extortionately long. I have begun the long process of being diagnosed with ADHD, but will probably be waiting 2+ years. If you believe something is wrong, and you should be able to go to someone and confidently say that they need some help and be able to access that help instantly. Your mental health should not be put on hold. Your brain controls everything in your body. If your brain isn't okay, it will begin to impact you physically. You should not have to be driven to rock bottom to be seen to be taken seriously. You're on mute, Cal.
Thanks for that, Grayson. And that's a young person that now volunteers with us, having regularly come to some of our support groups, which they outgrew. They didn't need anymore, but they're still involved with the BU service. Can I just skip to the next slide, please? So how are other people around the young person affected? So we do provide a parent support group, and we often see parents going through this kind of grieving process, and what we aim to do is bring them alongside other parents who are a little bit further ahead in their young person's journey, to show that there can be huge gains to supporting your young person to be who they want to be. More happy, more confident, and belonging. Obviously, sort of the impact in schools to other young people that might not identify as LGBT+, but are still targeted because they are perceived to be. Homophobia not being challenged within schools. It does affect everybody. Sorry, I'm really aware that we're running out of time, so can you skip to the next slide, Kerry, please? Sorry. So at the moment, all of the BU team identify as part of the LGBT community. Any professional can refer, any young person can refer, any parent can refer. All the details are on our website. We're able to provide group support and one-to-one support for anybody in the Kent area. And I would say now more than ever, it's really important. There seems to be a little bit of a backlash. Only in recent weeks did we receive there was a homophobic email sent out to all schools, and it was taken for as it was read, and we experienced some hostility getting into one such school because they believed this email that they had read that said, do not allow LGBT+ charities in school to talk to young people. And within that, it was linked to a genuine government document. So the teacher had taken it as real. And for some young people, especially if they have not got support at home, they can feel really lost. All of us have experience of those feelings. We can get them involved with other young people and help to give them a sense of community. I'm really saddened that in the last year we've seen the death of 2 trans teenagers in Kent. That neither were supported by the BU project. Maybe if they had have been, the outcome might have been different. So I really hope that if you're from a school or you're in contact with schools, you can talk about what we do and refer anybody that needs the support, because people don't need to be, taking such drastic measures as ending their lives. There's always hope, and a single thread of hope can be a very powerful thing. Thank you. I'll leave it there, Kerry.
Yeah, thank you both of you. That was really helpful. What's great is that you've given us some key things as partners delivering and developing services on the ground. What you've given is clear messages about how we can help make schools more inclusive. how we can make sure that we're listening and hearing and responding and making the services accessible. And I think what was also lovely listening to you is also making sure that we not only connect with our children and mental health services, but specialist services as work with children and young people in each of our areas. Porchlight is a fantastic service that is available in Kent. The key for us is there are other services in other parts of the southeast that do equally a valuable job. I'm very mindful that both Kel and Grayson need to leave us. So we've got a couple of minutes if anybody wants to ask any questions of either of them. Is that okay, Kel and Grayson? Can I open it up for a couple?
Absolutely, yeah.
Yeah, nice. Okay. Okay, any questions, anybody? Gail, you're looking at questions. Anything coming up?
I've got a comment.
Hi, who's that?
Hiya, I'm Lucia.
Hi, Lucia.
I just wanted to say I found that really interesting. Thank you for that. And sorry, can you hear me? My phone's messing up.
Yep.
As someone who I'm at a drama school in London, which is a lot more diverse than Bath, and I've got loads of friends that identify as non-binary and are part of the LGBT community. I just want to say how important I think those issues are, and it's so great to hear about change being made, and I can't wait to tell them that there's groups like you that are sort of there that they can turn to, because my drama school's in Sidcup, so it's quite near to Kent as well. So yeah, just want to say thank you, really.
You're welcome. You're welcome. Thanks for your comments.
So Gail, is there any other comments, anything else you want to pick up out of the chat?
There aren't any questions as such, but there are lots of people saying thank you for your presentation, how it's been really helpful, and also I think the fact that it wasn't just about raising the issues, but also offering some suggestions to people like the armbands in the school, etc. Because quite often, even if we want to do the best, we're not always quite sure what the best thing is to do. So it's really helpful as well, I think, to have those suggestions. So yeah, lots and lots of comments saying great presentation and thank you for sharing.
Oh, thank you.
Great, thank you both of you. I'm sure we'll be in touch with you again soon. Take care.
Thank you very much.
Bye.
Thanks both of you.
Bye.
Bye.
Okay.
Thank you.
Oh, hold on, there's Sue. Sue, did you want to say something? Oh, they might have gone, Sue, sorry.
No, it's fine, actually. I think it's more for the group that I think I want to say, which is, as working in Kent and working with BU and setting it up, I think what I realise is we do a lot of talking about what's important for young people to have access to, but then I really understand and see how culturally, organisationally and culturally we are behind on this issue as adults in the system, and how quite often this area of inequality is just not really taken particularly seriously. So we have these constant conversations. So we get BU to come and talk to our other providers that we commission through transformation funding, to talk to them about, well, are you asking the right questions, and really challenging, support and challenge across our other children's providers. We certainly don't feel we see kind of this level and depth of understanding in other more generic providers, but as well as adult providers. So the issues about system change, it's not necessarily about a service that's doing really, really well. The question for us is around how do we embed this as a cultural approach for system change? And we're really lucky because BU are really innovative and ambitious. So we're quite excited. We want to be kind of as accepting of these communities as Brighton or Manchester. We certainly are very behind in Kent, so we've got a long way to go, but I do think it's about system thinking.
Yeah, thank you, Sue. Okay, we've got another.
We've got Gemma question, I think, Kerry. We've got Gemma's got her hand up, Gemma Blesky.
Okay, Gemma, hi, do you want to ask your question?
Hi there. It wasn't a question as such. I was just going to build on what Sue was just saying. So also working in the same team with Sue within Kent, I work with Porchlight, and they're doing some work at the moment with our local university to kind of almost do a gap analysis of what services there are in Kent to support LGBT+ young people, and to make some recommendations. One example, it's around language really. For example, a trans man may need to go to for a smear test, but will generally be invited to a session that's called Women's Health. So some of it's around language, where somebody pointed out earlier, it sometimes it's just that we haven't thought it through because of it doesn't affect us in the way that it affects a trans person, and therefore having Porchlight working with us, they're working with young people who are affected by issues around language, which are actually relatively easy to solve in some ways. So once we have that gap analysis, which I think is due this month, hopefully that's something we can share with you all.
That would be really great. Thank you, Gemma.
No
I'm going to move us on now to Will and Lucia. Oh, is that my dog? Hold on, I'll turn it off.
Great.
Sorry about that. I try really hard to avoid the dog and she always barks at the wrong time. Okay, welcome Will and Lucia. Thank you very much for joining us. You've got about 15-20 minutes to do work around boys in mind and girls mind too. So I've heard you speak. I'm very excited to hear you again. So I'll flash up at 5 minutes before, like before.
Great, thank you very much. Yes, so my name's Will Reed. My pronouns are he, him, and I'm a youth advisor at Boys in Mind, Girls Mind too. We're based in Bath in the southwest of the UK. I've been a youth advisor for about 9 months, and I'm on a gap year at the moment. I'm also an ambassador for Just Like Us, which is a national charity for LGBTQ+ young people.
Hiya, I'm Lucia. I'm 19 and my pronouns are she and her. I'm also a youth advisor for Boys in Mind. I'm less experienced, if you like. I joined Boys in Mind in July and I'm a second-year drama student in London.
I just really want to thank you for the opportunity for us to speak today, because it really is as young people, it's so fantastic to have our voice truly heard at this kind of level. Next slide, please. So Boys in Mind, Girls Mind too is an alliance of young people and professionals with a particular focus on the mental health and well-being of boys and young men. Through our resources, we challenge and combat stigma and ultimately aim to prevent suicide. We work with 14 lead schools, 10 primary and 4 secondary in our local area of Bath and North East Somerset. Next slide, please. Boys in Mind, Girls Mind too is made up from both professionals with experience in school leadership, public health and leading PSHE and BAMES, to name but a few. Both me and Lucia are part of the team of youth advisors, of which we have 10 at the moment. We have 3 women, 6 young men and 1 non-binary youth advisor, with 2 who are black and minority ethnic, 1 who is gay, 1 who is lesbian and 1 who's autistic. At Boys in Mind, Girls Mind too, the youth advisors are truly leading. We truly listen to and our wishes are acted upon throughout the organisation, and we take leads on projects whilst at the same time being supported by the team in their professional capacity. Young people are not just tokenistic in Boys in Mind, their voices are truly heard. Next slide, please. Finn is our first primary champion, with Jackson being our other one. Both Finn and Jackson help out with the work that we do in primary schools. They come up with the ideas of projects that they'd like to see and do fantastic work. They also come up with a monthly challenge. For example, last month's challenge was to come up with a song every day that makes you happy and put it into a playlist. We actually all did this as a team last month, and it's something just lovely to do, especially given the sort of current situation that we're in. Next slide, please. Film is our primary resource, and on our website, boysinmind.co.uk, we have many examples of positive male role models showing their vulnerability, whether that be in our Men Who Care series, the Q&A, What Helps, our school film projects, and many more. When we do a film project in an assembly, particularly in a school environment, the young people, again, are taking a leading role. After we go in to engage the students for an assembly, we find those who are interested in taking part, and after teaching them some filming skills, they're actually left to do it themselves. They come up with the questions and how it's done, and it truly gives a sense of independence, as well as actually being a learning experience in itself about vulnerability. This is obviously not possible in the current climate of COVID, but earlier in the year we adapted the challenges of COVID with our Getting Through This Together campaign, which involved over 50 young people talking about the challenges, talking about the healthy and creative coping mechanisms that they had over lockdown. The 42 films were viewed over 35,000 times, and I'd highly recommend checking them out on the website again. I'll definitely be having a look at them over the next month. Next slide, please. So Beach and Cliff, A Whole School Approach to Mental Health and Wellbeing, is one of our more recent films, actually again done during the lockdown, where we document the steps that Beach and Cliff School in Bath has done to come to a truly effective whole school approach to mental health and wellbeing. I was involved in this film with with Beach and Cliff being my secondary school and sixth form, and I took with members from Boys in Mind, school students, staff, parent and management, and outside agencies. The film is around 15 minutes long and has a page on our website, so I really highly recommend taking a look at it. Next slide, please. Beach and Cliff based its approach on the 8 key principles to a whole school approach, developed by Public Health, which I'm sure many of you may well have seen before. All of these are equally important, and it helps to give a framework before going on to build your own whole school approach based on your existing strengths. Boys in Mind, Girls in Mind 2 actually prefers, instead of student voice, we prefer student leadership, as all too often a voice can be heard but not really acted upon. Next slide, please. These are some of the steps that Beach and Cliff School took to develop their own approach to mental wellbeing, such as student mental health team, the equalities teams, etc. These are again explained in more depth in the film on our website, as well as the supporting documents that I was involved in making. But at the heart of it, it's the aspect of student leadership. In both the student mental health teams and the equalities teams, students were involved in leading the change that they wanted to see. And they wanted to lead the testimonial assemblies where we talked about our own journeys, as well as opening the conversations for more people at the school, and role modelling good practice for talking about your own experiences. It was hugely cathartic for everybody who told their story, and yeah, it just had such a power for so many. Another of the key things that was done at Beach and Cliff School that was instrumental was the introduction of the solution-focused approach. This is a strengths-based approach to therapy, which is completely different to the problem-focused default of a lot of services. One of its key assumptions is that everybody is an expert in themselves, and this is an empowering approach, I can say personally, enabled me to come out as gay, and I've known that it's empowered so many to go on to do fantastic things. 100 staff at the school will have been trained in the approach as well, and so at the same time as being empowering in a more strengths-based environment, they've truly listened to us as experts in ourselves and acted upon our wishes. I don't believe that the work could exist without the solution-focused approach or authentic student leadership. Next slide, please. The work that's been done to develop a successful whole school approach at Beach and Cliff has had amazing results. Over the last 2 years, we've seen a 352% increase in people coming forward to talk about their own mental health. And as a member of the LGBTQ+ community, the equalities work that the school has done has made me feel much more at ease in myself. And I've seen loads of my friends also come out and say exactly the same thing. Next slide, please. It's difficult to put into words the huge impact that being involved with Boys in Mind, Girls in Mind 2 and the journey at Beach and Cliff has had on me. My own confidence has really built, and I felt more and more empowered the more that I'm involved in, such as this. After delivering my testimonies coming out as gay in the lower school assemblies, which was cathartic in the first place, I received feedback from a Year 8 student about how much it helped him, as it just wasn't the topic that was discussed. I was missing a role model myself when I was growing up as a gay man, and if I could just be a little bit of that whilst probably leading on change and development, makes me feel so thankful and happy to see that. I suppose in mental health services has been done in Beach and Cliff. I'd love to see a real push on the solution-focused approach as an approach to therapy as an option. I feel that this approach to therapy truly is where I am today, and its mindset really does help me in day-to-day life. All too often, clients in therapy can disengage because they don't feel genuinely listened to or their wishes acted upon. And I feel the solution-focused approach really mitigates that possibility, as it treats the client as an expert in themselves, as they're the ones leading whilst being listened to. I feel that the solution-focused approach also has a huge capacity for those in marginalised communities, as it often opens up the refreshing possibilities of a world that they may not have thought about before. perhaps because it just seems so difficult or different to what they're living in already. I know that by truly treating those in marginalised communities as experts in their own life and change, the world of mental health services and the world in general will be a more equal and compassionate place. I suppose my 3 bits of advice for what can be done better to support boys and young men in particular would be making sure that there's specific, for the first one, making sure that there's specific resources in place for specific people. And by that I mean, for example, men talking to other men about their own mental health, or an LGBTQ person talking to another LGBTQ person about their own mental health. We have many examples of men talking on our website, in our Men Who Care series, a Q&A. My second piece of advice would be making sure that good whole school approaches are in place. Making sure that schools are places where you're able to be open and equal with one another. Boys in Mind, Girls in Mind 2 has the film I mentioned earlier, which you can see on the website, as well as a webinar, which you can also see on the website, documenting the progress that Meeting Cliff has made to be a healthy place to be. And I think this is so important right now in the midst of COVID, as the world is so uncertain. It's important that we have a good strengths-based approach in place at different schools. Beeching Cliff is also in the process of making another film about equalities, so do keep an eye out on the Boys in Mind, Girls in Mind 2 website. My third final bit of advice, I think, would be make sure you're giving opportunities to young people to lead and truly be listened to. There's no better way to achieve someone else's goals than giving them the tools and allowing them to go on to change what they want to see. It's had phenomenal results in my own life, and the very fact that we are speaking today is an example of this. So I'd just like to thank you again. Our website has also got documents about getting young people involved, as it can, evidently be difficult sometimes. So do have a look at them as well.
Excellent. Will, before you move on to Lucia, could you put the website link in the chat?
Yeah, that's fine. Yeah.
But it's been asked for a couple of times.
Yeah.
Lucia, should we?
We have got the link, Kerry. It's in the slide pack when we send it out, so the link will be in there. But yeah, in the chat will be great.
Oh.
Hello. So can we move to the next slide, please? I don't know, is there any more slides? Yeah. Hi, so I'm Lucia. I'm also a youth advisor, as I said before, and I got involved in Boys in Mind by being approached for a project for a film. If we go on to the next slide. So Eli Green, who's another youth advisor who sadly couldn't be with us today because he had prior engagements, decided to get a group of 6 young people in Bath involved to talk about experiences they've had with racial inequalities and do a video as part of the Black Lives Matter movement. And it was through that I got involved in Boys in Mind. I think, as Will said earlier, one of the key things for me is it's really important to me as a youth advisor at Boys in Mind to be a positive role model to other people, as well as having a platform where my voice can be heard. And it's incredible that even just from working with the team from July, the response that I've got from people that have said, you've really given me a platform where I feel that my voice has been heard, and you've given me a role model to relate to, which is really good because, again, similarly to Will, as a young mixed race girl in Bath, I felt that I didn't have enough role models. So since that video, I've been involved in loads of things regarding the Black Lives Matter movement with Boys in Mind. Oh, sorry, I've seen Gail's raised her hand, so I don't know if I wanted to answer that. Do you have a question?
No, sorry, it was by accident. No, sorry, it was an accident.
Okay, sure, no worries. I have lost my train of thought. So since that video, I've been doing multiple projects with Black Lives Matter and Boys in Mind. I wrote a vlog about growing up in Bath with afro hair. I usually have afro hair right now. I've got braids, but naturally I have an afro sort of hair. And I wrote a vlog about that. And again, that received loads of positive feedback with people relating. And I recently was on the panel of the Baines webinar talking about Black Lives Matter, which was actually a really positive event. It felt like so many people cared, there was so much support, and I've got hope that a lot of big changes are coming. I think sort of in terms of looking towards what things need action, and these points I've sort of collated not just of my own opinion but also of the various events that I've been involved in since the Black Lives Matter movement started. I think firstly, there's a lot of issues regarding the fact that we have a Black History Month, because obviously for ethnic minorities and for Black people, it's not just a month that history takes place. And personally, and I know a lot of young people agree with me in the fact that our education system is very Eurocentric. It often feels as if we are learning about the white history, and I think that Black history needs to be ingrained into the school's curriculum from a very young age. And I think instead of us looking at it as black and white history, we look at it as history. And I feel like there's too much of a divide, and that's not mentioned enough in the curriculum. Secondly, I believe that there should be more Black role models within schools. I am 19 years old now, and as I said previously, I am a second year student at drama school in London. And the first teacher I had, not even just Black, but the first ethnic minority teacher that I had was when I was 19 years old at drama school. Throughout my years in Bath, I had no role model within schools who could relate to feeling judged and receiving discrimination because of the colour of my skin. And even just sort of having that figure of someone to look up to, in a sense that like they understand, something to relate to. So I feel that we need to really push employing ethnic minorities, employing more Black teachers, whether that be even with schools, like sort of more special guests coming in. And I believe that should happen right from primary school. And I know Bath is obviously a majority a white society, but I don't believe it's good enough to say, oh, well, we can't find any, because there definitely is plenty out there. So I believe that's really important. And I think finally, in terms of what I believe needs to change is, I know that a few schools, because I've been sort of in touch with leads from different schools around Bath recently, I know that a few schools have got a equalities team, which I think is a great idea and should be implemented in different primary schools and secondary schools, as I believe that having that team gives young people a platform and a sort of a support network of a place that they can go to when they experience racial discrimination, or when they have questions about their race. Why am I being treated differently to my peers because of the colour of my skin? And that was a question that I wanted to be answered right from my first year at primary school. So I don't believe that has an age limit on that. And I believe that these teams should be regularly mentioned and should hold regular meetings, so that it's not sort of just a once a year catch up to see how people are doing. Because for me, the racism that I experienced in Bath was definitely not a once a year thing. And I experienced a lot of racism beginning in primary school from a very young age. I'm at my 5th educational institute now, and throughout all of them, from the age of 4, I've experienced racism in different forms. I've been treated differently by my peers, by my teachers. And I believe that if these things are implemented in schools, that this would have a massive change. And I believe that these things should be implemented now, as I want the people sort of younger than me. For example, I have a younger brother who's 15 years old currently at St. Greg's. I want his experience of childhood as an ethnic minority living in Bath, as a Black male. I want his experience to be better than mine was, you know, and that's something that Boys in Mind really believes in. I think it's sort of making changes, and I believe that actions speak louder than words. So it's all very well me saying this, but obviously it's about whether these things are implemented. So thank you.
Thank you. That was great, both of you. Should we open it up to see if anybody has any questions of Will and Lucia? Gail, is there any in the chat?
Not at the moment, but I think some might come in. There is lots of conversation in the chat just saying what a great presentation, and lots of thank you to both of you, to Will and Lucia, for telling your own stories as well. I think it gives more meaning.
Thank you for having us.
Lila.
Yeah, Lila.
Hi, Lila.
Hi, I just I can't send my messages for some reason, so I thought I'd better just give you the verbal comments. Thanks to both of you, really good stuff. Will, I'm going to look at your link and see what learning we might take away and see how we can use some of that in Oxfordshire. And I think, Lucia, you know, I'm really pleased to see for the first time we're talking about Black Lives Matter. And personally, I feel quite disappointed that the NHS is not taking more of a proactive stance around that. So there's quite a lot of work that happens in local authorities where they have discussed some depth around, you know, what does this mean in Oxfordshire. But I think from a health perspective, we haven't really started that debate yet. And actually, I think we really ought to, as part of this whole inequality conversation, because I know COVID is on everybody's minds at the moment, and it is important, but I think, you know, there are some real underlying inequality structures that I think we haven't been that great at thinking about yet. And so thanks for bringing that up. And I think, you know, Carrie, sort of a plea to you that we start thinking about that more and some of the stuff that we do, and think more practically around how we can make a difference.
Great, thank you. Peter Kibaru?
Yeah, that's me. Don't worry, my name kind of gets pronounced wrong most of the times, but that was a great effort. I just want to say thank you for both of you for your presentation. My name is Peter and I work within the Surrey team in the user voice participation team. And I'm fairly new in that team myself, but we've kind of hit the ground running in terms of key discussions that I feel you guys have touched upon very heavily. And I think one of them last week was on mental health and the discussion that needs to be had with that topic amongst men. So we'll read it. I really find that inspirational. And also, Lucia, like a lot of stuff you were saying about Black History Month, a lot of it did hit home. Because yeah, Black History Month is not enough to condense our history within 1 month. We accept that. But yeah, like the things you said with education as well. We this week kind of were releasing content in and around role models in sports, film, all these genres to show the young community of the BAM young people that they are out there, and at the moment they're just not being brought to the forefront of your face for you to see them do the great stuff that they're doing. So I really do believe Boys in Mind and Girl in Mind is a great project that you're working on, and I would love to get in contact somewhere down the line to see how we can make this a county national-wide conversation that can hopefully bring some insight and light on both these topics. So thank you for having me today.
Well, Lucia, are you happy for us to link you over with Peter as he's requested? I can share your...
Yeah, I was literally
if that's okay, I'll read as well. We'll read as well.
Email.
Yeah,
no, and also, sure. I was going to say, if we could leave a link to the Black Lives Matter video that I was discussing earlier on, and a link to the blog that I've done recently to be shared with people as well. But yeah, I would love to get in contact. Thank you.
That's great.
Well, Terry, we do have a question in the chat actually from Judy Periton. And a couple of others as well, Will and Lucia, asking about how did you set up the equalities team, and were there certain criteria for the primary and secondary? So a few people kind of supporting that question.
So in terms of, setting up the teams. Oh, sorry, I feel like a couple of us talking.
We can hear you.
Yeah, in terms of setting up the teams, this isn't something as such Boys in Mind have done, because I'm no longer a student in a school in Bath, so it's more been something that we've been suggesting. I've suggested it at various meetings. I suggested it at the webinar the other day, and I know it's something that schools are looking to implement. So I suppose in terms of specific criteria for primary and secondary schools, that's sort of down to the individual schools themselves and how they decide to go about that.
Thank you.
Kate, our coordinator Kate is in the audience, so if there are any questions that we can't answer, she will she'll be able to get a written response to you after.
I think Kate has got her hand up, Will.
Yes, can I?
Yeah.
Yes, I'm Kate. Hi. Can I just say very quickly about the equalities teams on our website, and I can, Kerry and Gail, I can send you the link. There's a bit on our website about how to set up an e-team, and there are slightly different criteria for primary schools and secondary schools. But an e-team is a collection of children and young people who work in partnership with their teachers to, you know, challenge discrimination, celebrate difference, and all those things. But there is a place on our website that shows you how you can do that and the impact that can have. Is that okay? Does that answer that question? Hopefully does.
Yeah,
I'll mute myself.
Yeah, that's great. Thank you.
Okay, any more questions, comments? Peter, is your hand up again?
No, sorry, that's my failure to put that down, sorry.
No, it's fine, don't worry.
All good.
Okay, just check in with Gail. Gail, is there any more questions, comments?
No, not at this point. Just a few raised hands of people I think they've forgotten to put their hands down. Lila, Kate.
Oh, there's your blog, Lucia. I've just put it up on the...
Oh.
Oh, yeah.
Sorry, you didn't tell me to flick through these last ones.
Sorry, I completely forgot. I lost my train of thought in terms of the slides. So
that's
yeah,
okay.
There's loads of great stuff on the website. So yeah, check us out.
Okay, so Will, Lucia, you're very welcome to stay with us. Has anybody else got any more questions they'd like to ask Nisha from a public health perspective while we're here? Okay, I'll take that. Gail, is there any questions, or Nisha, do you want to have any final comments?
Kerry, yes, I just, first of all, thank you, everyone, to these young people. I mean, I feel so, it's so heartening actually to hear from yourselves and your point of view. I think because, it's easier for us to think we are experts, but unless we are actually constantly hearing your experiences and what suits you, we will never get to that cycle of constant and continuous improvement. So thank you for that. I think final point I wanted to, Kerry mentioned, which I couldn't mention before, is that any work in schools, I think for us to be mindful that there is a lot that's going on in school economy as we speak. They have to deal with health protection type of things. They need to think about mental health. They obviously need to think about curriculum. So for mental health support teams to bear in mind all the other initiatives that are going on, for example, well-being to education return project, several other things, and dovetailing this activity in a way that it is like a wholesome offer to schools would be very, very critical. And anything else we can do once you've digested those slides, by all means, get in touch. My email details are on the slides. So hopefully this is not a one-off workshop and more of a regular, constant conversation whenever we need each other. Thank you.
Okay, lovely. That quite nicely leads us into the final 8 minutes about what next. So what we were hoping from today is that we could really get a sense of how important it is in our journey moving forward that we have the ability to look at our data, to understand what our data is telling us, and to share with you the experience that happens when you hear the voice of children and young people and staff that work with children and young people. I think we've had some great messages given to us and some great ideas to take forward. We're moving into the implementation of our mental health support teams. We've had our Trailblazers live and running during this COVID for this year, but our Wave 1 and Wave 2 sites are landing soon in terms of becoming fully operational, and really understanding the needs of our different groups of young people and how we develop our service. It felt really important to land this conversation at this time as we're moving into our next steps. So I'm just going to open it up in terms of our thinking. What are the audience, as you've heard what we've heard today, what might be some of the things that you think would be helpful for next steps, how we land this, how we move forward with this? Lila, sorry.
I was wondering whether, so I have quite a lot of conversations at our board level for the mental health support teams into schools around how do we start thinking about health inequalities. And I think there's an issue for CAMS overall. So we all know that commissioning in the NHS, old style, is that you commission for the whole population. But actually I think, you know, we need to shift alongside all the other sort of changes that happen in the NHS and maybe some support around that. I looked at some other slides today around health inequalities for Bob, and what struck me was, of course, Bob, that's Buckinghamshire, Oxfordshire and Berkshire West, are really healthy, wealthy places. So once you start aggregating data, you don't actually really get the picture. You probably have to drill down to sort of ward level to start picking out where some of the real health inequalities sit. And I guess what might be helpful in us taking our next step is to just have a bit more of a framework that I think Nisha's probably started. To think about, you know, start with these cohorts, look at what your local data is, and then start actually putting some plans together around how would you go out and address some of the inequalities, and that will include some sort of working with young people and their families around what they would like to see.
Great. Some clear things we can take forward there. Anybody else? Gail, is there anything in the chat?
Yeah, we have a comment again from Nisha, just to say absolutely agree, universal services are good, but focus on health inequalities has never been more important like it is now. Lots of people in the chat saying thank you to Lucia and Will and to everybody for their great presentations and sharing of personal stories. And I think just from me, you know, the people that we're on this call with, or most of us, we do meet in various guises and various meetings. So I think the purpose of this particular webinar was to just kind of have a targeted conversation and to kind of bring this to the forefront of our minds. And very much what Kerry and I would like to do is to continue these kind of conversations. So in our meetings, and we've got lots of them, we'll be having kind of focus points and just saying, so how do we take this forward? What do we do? And I would really like to keep the link with Boys in Mind and with Porchlight and just have a continuous conversation to see where we get to, because, and as Nisha said, you know, this is all about continuous improvement. This isn't about, okay, what are the next steps and where will we get to? Or it is continuous feedback, continuous improvement. And sometimes it's the smaller things. It's not necessarily big, huge programs of work, all the little things that kind of add up. So yeah, but no more questions in the chat.
So Sarah, your hand's up.
Hello, I'm Sarah Fellows. It's my first day today with NHS England and Improvement. I'm the head of a clinical programme. And it's really difficult when you're the newbie, because I kind of obviously don't want to say anything that's kind of not helpful, but also you feel like you're going to probably state the obvious things, really, which can be somewhat embarrassing, can't it? But I guess I just wanted to.
You haven't got your photo on, so we can't see you.
That's what it is, yeah. No, I haven't got my photo on because my hair looked so awful earlier. I thought, oh no, it's my first day at work and my hair looks really bad. And it was supposed to be a real shock for everyone. But yeah, actually I haven't put my photo on because I'm waiting for the NHS England laptop to be configured properly, and this laptop I've got is awful. If I have the photo on, usually the sound doesn't work very well. But essentially, I come from the Black Country. That's the area that I live and that I have been working in for the last few years. And I was really impressed by all the presentations, actually, and somewhat inspired by them. But what we've done, particularly during COVID, is essentially we've employed community development workers to work specifically with certain populations, both BAME populations, but also LGBT plus. And I just wanted to say I'd be willing to share any learning, you know, and any evaluation if that's helpful. I'm certain that those are initiatives that you've got down here as well, but just would be willing to share that learning because it so far has been quite helpful actually.
Yeah,
That's
Sarah, I think that would be really great if we could share your learning through. So I'm just mindful that it's 1 minute towards the end. We've had some feedback from others about taking this forward, taking it through the local transformational plans, refresh, good ideas about landing the work we're doing around mental health support teams. So there looks as though we've generated some thinking and some ideas for you to be taking forward. So as Gail was saying, in terms of our support to you from NHS England, we will be working alongside you as you develop and land and progress the work that you're doing around. We started with mental health support teams, but actually this rolls across all of the work that we're doing with children and young people. And this is a continuous journey that we need to take together. The key things I think that's really come across today is understanding what the data is telling us, but also really hearing the voice of young people and really having them alongside us as equal partners in the development of our next steps and our work that we carry on in the future. I really look forward to carrying on working with you. It's 3:30. Have a lovely afternoon, everybody, and I hope you've enjoyed this conference WebNext as much as we have. Take care. Bye.
Thank you.
Thank you.